Greetings, everyone. My name is Tammy Bryant Spratling, and I'm the Chief Executive Officer of Community Tampa Bay. I'm so pleased that you're joining us this afternoon for both in-person and virtual audience here for our Huddle for Change initiative. Today's conversation is especially timely because this is National Suicide Awareness Prevention Month. Due to the content that we'll be describing this afternoon and the conversation that we'll be having, I'd like to remind you that the Suicide Prevention Lifeline number is 800-273-8255, or TALK. So that's 800-273-TALK, 8255. Community Tampa Bay envisions a community free from all forms of discrimination, where every community member is respected for their race, ethnicity, nationality, sex, sexual orientation, gender, ability, age, faith, and class. We truly believe that if we build an inclusive community of leaders who are comfortable engaging in dialogue like we're having today, then we can eradicate all of the biases, prejudices, and stereotypes that create a space of systemic discrimination. So today's conversation is going to be all about ensuring that we have these conversations in particularly the space of mental health and race equity. We are so pleased to have this partnership with the Super Bowl Host Committee. This is our third of the series that we're having together. Each one of these has a different topic. We've already covered physical health, and now tonight is our mental health. The next three topics will be wealth gap, education, and the criminal justice system. So we hope that you'll join us again in those sessions. We want to say thank you to our Super Bowl Host Committee partners, and some of them are here in today's live audience. So thank you so much for your support and for being here. For these community conversations, we use data from the Tampa Bay Partnership, and Dave Sobush is going to be joining us with a video to overview that data as related to mental health. After that, we will then have a panel discussion of panelists that are coming from the community. These are experts in the space of mental health who are already doing work committed to race equity. So we're so pleased that we'll have them join us. Then we will move into small group dialogue, and that's where we hope that you'll stay tuned and interact with our Community Tampa Bay facilitators, who will walk you through some conversations and some questions that we have for you to think about. We also have a follow-along worksheet that we have provided, and at this time, we're going to be dropping that in the chat if you're joining us in person. Virtually. And if you're in person, we have those on your table. So we hope that you'll use those as you're having your conversations this afternoon. Moving forward with the first part of our program, I need to introduce all three of the key people who are going to be supporting us today. First is going to be Dr. Ruth May Sears from University of South Florida. Next, after that, will be Esma Lopez, who is our Community Tampa Bay AmeriCorps Vista. And also, first, you'll actually hear from Dave Sobush, from the Tampa Bay Partnership with our data. Dr. Ruth May Sears is an associate professor at the University of South Florida. Her research focuses on educational curriculum issues, the development of reasoning and proof skills, clinical experiences in secondary mathematics, and integration of technology in teaching and learning of mathematics. Esma Lopez serves as Community Tampa Bay's year-round AmeriCorps Vista, and Esma is also a graduate of our signature youth program, Anytown. Dave Sobush is the Director of Policy and Research at the Tampa Bay Partnership. He is an expert in economic development, research, and project management. In his role at the Tampa Bay Partnership, he leverages a career of project management, data analysis, planning and reporting, and development and implementation of recommendations to enhance prosperity and economic competitiveness throughout the Tampa Bay region. Now I'm pleased to turn it over to Mr. Dave Sobush, who will give an overview of the data, and then we'll pick up with Dr. Sears, as well as Esma for the rest of our program.
Good afternoon. I'm Dave Sobush, Director of Policy and Research for the Tampa Bay Partnership. I'm pleased to be with Huddle for Change and all of you today to share some data insights into the state of mental health in the Tampa Bay region. We do work like this through our State of the Region initiative and are proud to have as partners in that endeavor the USF Muma College of Business, United Way Suncoast, and the Community Foundation of Tampa Bay. Through the State of the Region, we've produced the Regional Competitiveness Report, an annual benchmarking effort comparing Tampa Bay to 19 other communities across 66 indicators of competitiveness and prosperity. And last summer, we dove deep into the data with our Regional Equity Report. The suggestion to do so was made by the hundreds of stakeholders we've convened each year to kick the tires on our benchmarking efforts. Another suggestion from our stakeholders was to include among our indicators in our most regional competitiveness report a relative measure of mental health providers. When we did, we found that Tampa Bay ranked 17th out of the 20 markets in the report. By way of comparison, our 14.36 mental health providers per 10,000 residents is roughly 3/4 of the Regional Competitiveness Report median, a little more than half of the US average, and less than 1/3 of the Portland Metro, the top performer in our analysis. As I frequently say, sometimes research asks more questions than it answers. So I'd like to take just a few more minutes to explore some additional context around mental health in Tampa Bay. Besides the relatively low supply of mental health providers, an additional constraint facing our community is our low ranking in health insurance coverage. We rank 16th out of 20 markets, and at 81.4%, nearly 1 in 5 Tampa Bay residents lack health insurance coverage of any kind. When we look at the gap between coverage rates of white residents and Black residents, we find that Tampa Bay ranks 9th out of 20. This is, in large part, due to relatively low coverage rates for both racial groups, does not take into account quality and access differences between public and private insurance, and as such, still signals an inequity in the marketplace. Within Tampa Bay, we find that communities south of the Skyway Bridge have the largest equity gaps and the lowest rates of coverage for Black residents. And while supply and ability to pay for mental health services are relatively limited in Tampa Bay compared to the Regional Competitiveness Report markets, the demand for mental health services is strong. This chart, showing the frequency of Google searches for therapist near me, shows a steady increase in searches over the past year. Your guess is as good as mine as to what caused the dip in searches in late 2018, but we can see that searches peaked in the quarter ending May 2021. After looking for help, a logical next step is asking for help. Each year, 16 million people in the United States dial 211 for help with basic needs like food and shelter, paying bills, and increasingly, finding mental health services. This chart shows data for the 3 211 exchanges serving the Tampa-St. Petersburg-Clearwater Metro, the Crisis Center of Tampa Bay, 211 Tampa Bay Cares, and United Way of Pasco County. What we can see here is that the majority of calls over the past year have been for substance abuse and addiction issues. Combined with general mental health services, these two categories account for nearly 82% of the total calls related to mental health. As a side note, as a share of all 211 calls, mental health related calls accounted for 20% of the 250,000+ calls to 211 last year. Let's dig a little deeper. This chart shows the number of calls requesting mental health services assistance made to the Crisis Center of Tampa Bay, the 211 exchange serving Hillsborough County. The big takeaway is that while largely flat from March 2020, when the pandemic began, until November 2020, there has since been a dramatic increase, more than 300%, of calls to 211 seeking mental health services. This chart shows the number of calls requesting substance abuse and addiction assistance made to the Crisis Center of Tampa Bay. The big takeaway is that while calls from August 2020 to March 2021 trended below their prior year, since March of 2021, these calls outpaced the prior year's volume. Finally, there's been an increased and welcome awareness of substance abuse as a mental and public health crisis. And certainly the opioid use disorder and opioid epidemic has challenged many Tampa Bay families and businesses. This table, showing data from a forthcoming Project Opioid Tampa Bay report, makes clear that the most rapid increases in death rates from opioid overdoses between 2014 and 2018 have been among communities of color. Black non-Hispanic death rates from opioid overdose more than tripled, while among Hispanics, the rate increased nearly 2.5 times. That's a lot of information in a short time, and I appreciate your attention and leadership as you convene today around the important topic of mental health. A quick plug that you can review and download the regional competitiveness and regional equity reports at stateoftheregion.com. Thanks again to Tammy, the team at Huddle for Change, and all of you.
So joining us today, we have Travis Archman, Terry Ballett, Natasha Pierre, Liliana Rios, and Denise Whitfield. So at this time, we're going to invite the panelists to introduce themselves.
Thank you so much, Dr. Sears. Good afternoon. My name is Denise Whitfield. I am the Executive Director of NAMI Pinellas, the National Alliance on Mental Illness.
Good afternoon. I am Natasha Pierre. I'm the Executive Director to Denise in Hillsborough County, NAMI Hillsborough. I'm also a peer, so I identify as someone who lives with a mental illness.
Good afternoon. I'm Liliana Rios. I'm a community specialist for Florida Blue, a health insurance company.
Good afternoon. Thank you so much for having us here today. My name is Terry Ballier. I'm the Chief Operating Officer with Gulf Coast Jewish Family and Community Services.
Hello, everyone. I'm Travis Atchison. I'm the Program Director of the Community Assistance and Life Liaison Program with Gulf Coast Community. I'm so sorry, with Gulf Coast.
No problem, Travis. Now, we're here really to celebrate and reflect on racial equity. So let's get started. With respect to mental health, how should equity be conceptualized with consideration to the various individuals' unique identities and their potential intersectionalities?
Great question. I think the first thing that we need to all recognize is that mental health challenges and mental illness does not discriminate. And I think we see that increasingly day after day. The next thing that I would recommend is that we all approach the mental health conversation from a place of humility, recognizing that every person is the sum total of their nature and their nurture. And if there are intersectionalities, that has not only affected their knowledge of treatment, but also their access and their ability to maintain it as well. So I think we should start there with humility and then have the conversation.
Thank you, Natasha. So there is the phrase, she's a strong Black woman, or real men don't cry. And they're commonly stated. How does the intersection of gender and race impact mental health, care, and potential opportunities? And what could be done to address stigmatisms relative to mental health in marginalized populations?
First and foremost, as a clinician, these are two statements that I've encountered very much in depth within our communities. And I like to recognize that these are culturally and societal embedded notions. To give a little insight, I've engaged children that are 4 years old on identifying, recognizing, and expressing feelings and emotions, and I've used those same interventions with adults and elderly populations in our community because there is this stigmatism that we need to be tough, diverse populations especially. I see this all the time in my clients, that they don't have time, they don't have the capacity to express vulnerability, to even receive empathy in a certain degree. So addressing this on a community level in our institutions, educational pursuits, especially in our community mental health facilities, is imperative to start recognizing the traumas in the home, the traumas in the community that elicit these feelings and these behaviors that leave individuals without the ability to display this vulnerability.
I want to extend the question, Travis, a little bit, because you made a note of trauma, and some persons would say, well, that's just life itself. So how do you have them own that truth relative that this should not be normal, and perhaps reflecting on healthy ways of communication?
Right, so trauma is something that is evident in our society. Trauma is something that many of us experience, adverse child experience, all the way through different components of our adult lives. So are you asking how we can have a conversation on how to, and trauma, yeah, there's a lot of implications associated with trauma. So, community dialogue, and this begins grassroots, especially your neighbors, your friends, your associates, church members. These things begin in the community at the micro level to start exploring and discussing the implications of trauma in the individual's life.
Thank you, Travis. Liliana, you wanted to add to it?
Yes, I did. Thank you. The phrase strong black woman, I feel it was created to empower, but I can see how it can also do the total opposite. It's important to normalize that seeking mental health care is a sign of strength, not weakness. So you ask, what can be done to address stigmatism relative to mental health in marginalized populations? I feel we need to, one, make certain our mental health clinicians are culturally competent to avoid misdiagnosing BIPOC, Black, Indigenous people of color. Given the medical history of the treatment towards minorities in the past, we need to make an effort to earn the trust of communities of color. We need to raise awareness about mental health issues in these underserved areas. We need to contract more providers from different racial, ethnic backgrounds. And lastly, we need to hire racially and linguistically diverse staff in all levels throughout companies and medical institutions.
Thank you, Liliana. And I want to highlight to everyone, I'm a black woman, I'm a strong black woman, but I am someone who's always willing to seek help because support do make a difference in your functionality and your ability to be your optimum best. So, yes. Natasha?
I'm not a fan of the strong black woman. And I agree with Liliana. It probably originated as a term to empower. But what it does, it positions me outside of the populace that receives empathy and kindness and warmth and support. And so I have to be my own advocate really at all times in order to get what other communities and other populations and other demographics get freely. So I don't embrace that at all. For the purposes of mental health and support and care, see me as weak and I'll be able to get what I need.
And that's okay, yeah, because to each its own, and our goal is really to reflect on what the individual need and really figuring out how could you develop the support needed because we're all different, and that's very, very important. So thanks for providing your insights. Now, the next question I had was, what access to mental health care is currently provided, and what are the barriers that impact individuals from obtaining care? And I think Natasha started actually going towards it, but Denise?
No, that is a great question. So let's address the first, access to care. I think that is very important in all of our communities. So in some communities, like in the Tampa Bay area, fortunately, there is NAMI, the National Alliance on Mental Illness. We are a peer-led organization, and we provide free support services. And those services involve support groups, education courses, referrals, and resources. So that's very important, and we have NAMIs all over the state of Florida as well. Second of all, we do have a very robust behavioral health agency partners within the Tampa Bay area. And these agency partners, they are experts in their fields. So we have that. And then here in Hillsborough, they just launched a new initiative called Let's Talk, which is a navigation program for individuals that they can call in to help them navigate those mental health waters and really connect them to those pathway recovery partners. And then on the other side of the bridge in Pinellas County, we have the Wellness Connection. Again, that's kind of like the same model where all of us behavioral health agencies are coming together to provide this free support service. They can call in and we will connect them to the appropriate access to care. Now, on the flip side of that, are there barriers? Absolutely. The biggest barrier that we are seeing, number one, is cost, right? A lot of insurance companies might not cover mental health services, and that can be a huge detriment in somebody's recovery. Here in Florida, approximately 800,000 Floridians are uninsured. Of those, 49% say that they're uninsured because of cost. And then another barrier is just the relationship that the Black-Brown community might have with the behavioral health partners. Again, we need to expand our community of color when it comes to providing behavioral health services. And some individuals might feel, that stigma around talking to somebody that's not of color, talking about racism, talking about what is going on. So I think we need to look at that barrier. How can we include more of a population of color into the behavioral health community? Those are some major barriers. And then, of course, transportation. How are we getting to and from these appointments, and what is that costing the individual? So those are some access areas and some barriers. And I believe, Terry, you wanted to add to that.
Thank you so much, Denise. I really wanted to focus on the funding component. So if I may, sure. Would you like me to go into? Okay, so I think that what's important to note here is that Florida is ranked 50th in the nation as it relates to mental health funding, or I should say lack thereof, and per capita spending. The funding starts at the legislature, and then it's annually appropriated through many entities, such as the Department of Children and Families, Substance Abuse for Mental Health, Department of Juvenile Justice, and there's others. And then at that point in time, it's passed through to local providers. Now, the local providers are biting for the same pot of money, the same dollars. And so the problem there is that the funding, it either comes to us in a couple of different ways. One, it's time sensitive and time limited, or it's non-reoccurring. That's a problem if we get non-reoccurring dollars. When you set up a program, you get the program ramped up, ready to go, hiring individuals, and then you're not sure if the dollars are going to be there the following year. That's a problem. There's no comprehensive plan or coordinated agency to really track these funds. So what's really important here to remember is, always look at blended funding. Very important, and always look at ways to be innovative and transformational. And so one of the ways in which we were able to do this, Gulf Coast, is we built a pilot program called Community Assistance and Life Liaison that Travis is the program director of. And that really was being transformational. We started that program based on the protest of George Floyd murder. Very important for us. This is a social work program, again, transformational, a social work program that has both clinicians and navigators who answer 911 calls that are either non-criminal or non-violent calls. And we go out into the community and we work with those clients until they're wrapped around with appropriate services or we can meet their needs. And that's obviously that's able to, free up the officers' time so they can really work criminal cases. That's important, again, transformational and innovative. I will say that, often we get the question, well, how do you make money off this program? Or why are you not charging other providers for services, maybe long-term services that we can't necessarily provide We don't do that. Again, we're all biting on the same dollars, the same pot of money. We don't charge one another. We're working with similar clients, indigent clients. So that's another barrier. I know I went a little bit far with that, but I think it's important to notate.
Thank you so much, Terry, because what you're going towards is really investing in this space. And a colleague of mine, like Denise Davis-Carton, she had the truth framework. She said, teach, reach, unite, transform, and heal. And so your responsiveness to the situation was critical, because too often we turn a blind eye, but it's in those moments of crisis, like the George Floyd, I mean, just watching that video, it brought tears to many people's eyes. It brought trauma, just seeing it in the experiences. So you're responsive to the community. That was critical, and for that we say thank you.
Thank you.
Yes, and so looking back at the data, so according to the data that was shared, there was an increase across racial and ethnic groups in opioid overdose death rates. In fact, there was an article in the Tampa Bay Times about it just recently. So what strategies can be used to reduce or potentially halt the number of overdose cases that are being reported?
Right, that is something that's very evident locally, regionally, and across the nation. And one traditional approach to addressing the opioid crisis and substance use disorders in general is abstinence-based approaches. I'm definitely an advocate for a more compassionate approach, a more understanding, and a more universal approach under the name of harm reduction, which is a set of practical strategies and ideas that seek to reduce the negative consequences associated with drug use. On a simple level, I'm not here to tell you what to do. You, the individual, you are your own expert, and I need to recognize that. And you know what's best for you, and I'm here to support you and guide you. And harm reduction focuses on aspects of safe use, safe drug use. And what that looks like is minimizing the harm associated with illicit and licit drug use. We're looking for managed use, abstinence, and focusing on where the individual is in that moment. You know, one thing I'd say, you know, where are you? Where's your head right now? Where are we behaviorally? Let's build on that. But it's important to recognize that drug use, both licit and illicit drug use, are a part of society right now. So we need to focus on minimizing the harm associated with drug use in both of those fashions. And taking a client-centered approach is very important for organizations to start implementing in their practice. Again, abstinence, I think, is becoming more obsolete, and it shouldn't be the primary focus. But if that's something an individual wants to pursue, again, they're their own expert. We should support them and guide them in those efforts. But also looking at the components of poverty, class, racism, social isolation, again, trauma, sex-based discrimination, these social inequalities lead directly to vulnerabilities and implicate the capacity for dealing with drug-related harm.
Thank you, Travis. Now, I want to ask a question relative to policies and practices. So Terry kind of started with funding, because that affects decision-making as well. So my question is, what policies, practices, and funding are being implemented to address calls for mental health to emergency hotlines? So I know Terry started speaking to funding thus far, but are there any interventions that should be scaled up in the future? So we know where we're at, but we need to figure out where we're going and how should we get there. So Denise and Terry, do you want to respond to that?
Yeah, Denise.
Okay.
Sure, thank you. One of the things that's coming down the pipeline is 988, and I think that's very important. So 988, like 911, is going to be that go-to number for individuals that are in a mental health crisis. And so right now, you know, we are all looking at funding. Who is going to be funding that? Who is going to be answering those calls? How are those calls going to be dispatched? But 988 is supposed to be coming down the pipeline in June of 2022. And so this has been a really hot topic in the behavioral health world of, you know, what is that going to look like and who is going to man that phone? So I'm glad to see that that's coming down. We are definitely revving up for that. We know that line is going to be used a lot by our community.
Wonderful.
We're also looking at the inclusion of peer support specialists. And one of the things at NAMI Pinellas, one of the initiatives, is to start incorporating and increasing visibility of peer support specialists throughout the recovery process. Being able to speak with and connect with someone who has your lived experience, whether it's mental health or substance use, is invaluable. And the more organizations, corporations that we can get to understand that and see the value in it and to pay them a living wage, the better.
Thank you. So I have a question. So in the data set, Tampa Bay had the lowest coverage rate of 84.7% for insurance. Hence, what role does insurance company play and can potentially play in the mental health individuals receive?
Thank you for that question. That's a very good question. Insurance companies definitely play a role in the mental health ecosystem. And that's why I'm here today, and that's why I show up to work every day. But let's be frank here. There's definitely a systemic problem that has been around for centuries, especially within our brown and black communities. And here's what we can do and what we're doing at Florida Blue. We're advocating at the local and national level for better policies and practices. We're pledging a $25 million investment over the next 5 years to address racial injustices and health inequities. We're increasing access to affordable health care options. We are the largest single state enroller of the Affordable Care Act. We're supporting organizations doing this work on the front line like Community Tampa Bay and dozens of other local organizations. We've partnered with New Directions Behavioral Health that has available counselors, and since the beginning of the pandemic, we've assisted both members and non-members in the state of Florida with mental health clinician referrals and in-the-moment support. Our president and CEO, Pat Geraghetti, remains a strong advocate in the fight for equality within the healthcare system. We listen, we remain proactive, we're committed to change.
Wow. So I want to make some, because Liliana had a compacted statement. She talked about leadership. She put $25 million. Did y'all hear that? Yeah. Just making sure. She put her money where her mouth was. They talk about partnership and connecting because it's critical. We cannot do it individually, but we could do it collectively. And then she also identified the leaders' willingness to carry the work forward. It is so critical. Leadership influences what occurs in those organizations. So we're pleased that you gave us lots of information, but also a lot of food for thought for others who want to emulate.
And now I want to give the real life application to how insurance companies work. The reality is that many people who need mental health care are not going to receive it. One of the programs that I was fortunate enough to be in, an outpatient treatment program, I got because I had great insurance. And on the day that my then employer released me from service, I no longer had my insurance and I was no longer eligible for that program. So the program that allows me to be here, speaking with all of you, is not what everyone is going to be able to receive. So yes, we need insurance companies to provide the dollars, but we also need state, national funding to ensure that people who are not working, who cannot afford their COBRA, who do not have the insurance, can get the care that I received because I did.
Thank you, Natasha. So you're actually echoing what Terry highlighted, that we're ranked 50th in the nation for lack of funding. So perhaps this is where we go back to policies and potential laws that may need to be formulated to protect the wellness of individuals, particularly the mental wellness of individuals. So that's a very insightful
Absolutely. And I think part of the problem is we're still not recognizing mental health as health. We're separating the head and the mind from the body. And so there are a gazillion services for everything neck down. But when we're talking about mental health, the stigma still exists, even in the industry, that there's probably a character flaw. And so that's why we're lagging behind, not just in the state of Florida, but nationally as well.
I think your comment actually launches my follow-up question because it goes towards reflecting on humility and really thinking about how do we cross those borders? How do we connect to individual competencies? So my question is, how could our cultural competencies and cultural humility be considered in the mental health space support offered? And to what extent is historical trauma considered in these spaces?
Great question. You know, one of our values at NAMI is compassion. That's kindness, empathy, and respect. And if we begin there, if we begin speaking around that shared value, it gives space for us to recognize and to hear different experiences, because we all have different experiences and none is right or wrong. When we look at historical trauma, we know that there's data that shows that historical trauma, whether it was the Holocaust, whether it was Native Americans, whether it is slavery, we know that there has been an impact generationally with the way those communities respond. And so for our our clinicians, our mental health providers. First, here's a stat for you. 55% of U.S. counties do not have a single practicing psychiatrist. So we already know that there's a deficit with the mental health providers. We now know that we're not matriculating enough mental health providers. And so the need is growing, especially in a COVID world. Are we going to always have culturally competent mental health providers? No. The data shows that we don't have enough. So where can we begin? Humility. Recognizing that, no, I do not know your experience. Tell me about it. Tell me what I need to know in this experience so I can be present to support you and so that I can support others. If we begin there, and I know talking about race and ethnicity is a tough topic, but we've got to continue to have these courageous conversations because it truly is life or death. That's where we begin.
Wow, thank you. And so you brought to light the lack of funding and lack of access. And so this goes back to how do we market it? Because you talked about below the neck. And that's critical because how do we have value above the neck? And it goes back to marketing. So in this regard, my question is, what marketing strategies can be utilized to promote mental health care, particularly for a diverse population?
Sure, I can start. So I think it's really important to be able to reach out in whatever venue you choose to do that. So public service announcement, billboards, TV, radio, what have you. Get the word out. Market any way you can. Facebook, Twitter, right? We're all used to that. Any way that you possibly can get the word out, just to be able to break down the stigma. You know, this kind of goes hand in hand with what I was mentioning earlier around the funding. Speak with your legislative representative, city council, get into the neighborhoods. When we partnered with St. Pete Police Department around this community assistance and life liaison program, you know, that was one of the first things that we did. We got into the community. We had community conversations. We got into the neighborhoods so that we could truly hear what's the need? What's your greatest need? How can we impact? And that for us was just significant in moving forward in marketing and just building this pilot program. Denise?
Yeah, and thank you, Terry, by the way, because that work in St. Petersburg is notable because each one reach one. So your efforts to support mental health rather than just policing is showing a transformative approach to really healing the community.
Yeah, and I think to build off what Terry was saying about those marketing efforts, you know, with the billboards and looking at your literature, I think too we can start a community intervention. And what does this community intervention look like? And it would look like a multifaceted partnerships, really digging deep into your community, identifying, seeking those individuals that are community leaders that want to learn more about mental health and behavioral health all in all, and that want to share their stories. And working with our other community partners like barbershops, coffee shops, because we all know, you know, when us ladies get our hair done and the men go right into those barbershops, who do we tell all of our problems to? The barber, the hairdresser, our stylist. So, you know, again, include those multifaceted partnerships in your community. And the other big way to market it is go to your faith-based organization. You know, in behavioral health, faith-based spirituality is so important to an individual's recovery. I'm not saying that's not for everybody, but I think for most people, it really is very important. And I think, you know, working with your faith-based leaders, just to let them know that, hey, you know, we don't want you to diagnose or assess, but you know, learn about the resources, you know, and build upon the resources. Invite us in. Let's have those conversations. And I think, you know, building that multi-factor partnership in the community is so vital and so needed in all communities.
Thank you so much, Denise.
I'll add, another form of marketing is exactly what I'm doing right now. Normalizing the conversation that it is possible to live with what's considered a severe mental illness and still be an executive director or a cameraman or a photographer or a CEO or a doctor. It is possible. And the more we have those conversations, you know, I should be as comfortable telling you that I'm going to my therapist or picking up my meds as I am about telling you I'm going to, you know, I need a root canal or, you know, I need to go and get my back aligned. We should normalize the conversations, and that's another form of marketing.
That is so critical, where you own the fact that I'm not well, or even responsibility is that, hey, I need to take care of me. And that's so important that we have to really reflect on how to make that okay. Now, I have a question, because you brought into the role of faith-based organizations, because we all want to do our part, but the question is, what do we do? So my question is, what advice would you give to social, professional, and faith-based organizations seeking to establish community outreach to promote mental health initiatives, particularly and predominantly Black and Indigenous people of color communities?
Again, I think, really having those faith-based leaders or those community leaders reach out to community organizations, like NAMI, behavioral health agencies like Gulf Coast, Florida Blue, and really everybody in the community. Because again, when we have a problem, we always go to, I'm going to pray about it. And again, faith-based spirituality is so important, but you're putting that burden on your pastor, your reverend. And again, they became a pastor or reverend for a reason, but they're not mental health providers. They don't treat, they don't assess, they don't diagnose. But at least if we can give them the tools and the resources to say, you know what, I'm glad you came to me. Yes, let's pray about this. But also, I'm going to share with you resources right here in the community that can help you. And I think that's very important, is to have those conversations, not only with leadership, but also with the congregation. Let the congregation know that, you might have somebody amongst you that's been diagnosed with a mental health condition. Invite them in, pray with them, but also learn about the resources that you can direct them to so they can start their recovery.
Thank you so much. So my last question is, what are concluding advice or comments each of you wish to share with the audience?
Okay, I'll start and then pass it down. I think, it's strength over silence. Again, like we've all talked about, use your voice. Here at NAMI, we always, one of our strategic initiatives is to start the conversation early, early intervention, early prevention. But the stronger and the louder you use your voice, it's going to, spearhead of movement that it's okay not to be okay, and it's okay to seek help.
Mental health is health. Recovery is possible. I want my life to be the rule, not the exception. I don't want anyone to think that I'm brave and to marvel that I'm sitting here. I want anyone who's living with a mental illness to be able to fulfill their goals and their dreams.
I am always stating these two words: advocate, educate. And the last one I got from the amazing Dr. Sears, elevate. Advocate, educate, elevate. That's going to be my motto now. We need to make a collective effort to make the change that we want to see, and it starts with each and every one of us, and we can make a difference.
Thank you. Gulf Coast Jewish Family Community Service tagline, lives uplifted. I think that speaks for itself.
Something I try to instill in my team when we respond to 911 calls and help individuals in crisis is to build upon resilience. We all have resilience. We all have that strength, and to look within what's worked for me in the past and what can I take that I've overcome, those skills that I learned, those values that I've inherited, and how can I build upon those?
Thank you. So what I take away from all of that is educate, elevate, support, nurture, and just basically care and respect humanity. So as we move forward, our goal is to really make it safe to seek mental health and fund mental health as much as feasibly possible. Thank you, everyone. And thank you, panelists, for your time. Thank you.
All right, I'm gonna take it from here. This is the part of our evening where we do break out into our breakout groups and into our small group discussion. So from here, our in-person participants and our virtual participants will be separated at this point. We're gonna have everyone in this room come into one large group, and from there, our virtual participants will also have our trained CTP facilitators who will take them through our discussion on mental health, and in the spirit, like our panelists said, on normalizing this discussion with a collective effort. All right, welcome to the stage. I will say that as we were having these discussions, I did hear some amazing dialogues going on. And when we are thinking about the concept of racial equity and mental health, I was noticing that we always think about it in sort of a distinction, a binary sense. We're always thinking about this is the race issue, this is the mental health issue, and not really making the personal, political, and going deeper within that intersection. I think the small groups, they give us the opportunity to make that personal political, see how it impacts us on both that systemic level, that communal level, and that individual level. And that's exactly what I want to get into with all of y'all. So if we can start with Harrison down the line, and if you would like to share the highlights of what your small group discussed, as well as with Manolo.
One way of destigmatizing mental health through ads may be better for one community than another. So we talked about how PSAs might be more effective for one community as opposed to kind of doing a grassroots type movement and actually going out and speaking to the communities in a different way. And moreover, we also talked about how those PSAs require a certain amount of like inventory and funding. And if you're not connected to a certain organization, or if you don't have those kind of connections, it might be harder for you to get out that message by way of billboard or radio ad or etc. Something we also talked about was seeing people as people. So if I look at you, if I look at anybody who identifies with a mental illness, am I seeing that person or am I seeing the mental illness? So that kind of goes back to just having those like regular conversations with people and really being able to internally destigmatize mental health by way of just getting to know somebody, getting to know mental illness, and really just being an ally to people with mental illness.
Right, and we had some really great conversations going on, and we definitely touched on, the way that race and mental health are just so intertwined, and also class, in that if we just look at these structural issues, like for example, like the trauma that is going on, especially to for black people, to black people, by these like the people that are dying from the police officers, and just watching it too, like just watching it, you inherit that trauma and you get used to that trauma. And there's this structural issue here that like it affects mental health, but like you can't just solve it like with mental health. Like we have to solve the structure as well. And then we definitely talked about as well as housing, right? Right now, like especially here in Pinellas, like housing is so hard to find. And that especially affects communities of color, of not being able to find housing and like having to look for that help, but then also like this is stressful. This is not an easy thing to deal with. Like, so it just affects your mental health deeply, but the first thing that you're focusing on is the physical aspect, and you can't really focus on the mental aspect because you're still in it. And definitely a big thing that we talked about also was just time. Like a lot of this, like, and able to process and able to cope, we really need time, and it's hard to definitely find that time as well.
Hello. We had a great conversation at my table. One of the things that we talked about were, what is our approach when we are speaking to individuals who may not have much experience or little value when it comes down to mental health? So one of the things that we discussed in approach was to listen first. Take an opportunity to listen to that individual, maybe ask them what they do know about mental health, and then starting from there. One of the things we also talked about is the concept of privilege. So just being able to say that you were able to pick up your prescription, you're able to drive to your pharmacy. Some people have access issues. And so when you are working with those individuals, recognize your privilege as well. When we revisited some of those barriers to mental health, we also talked about one that stood out to me, which was the wait time. I didn't even realize that some individuals have to wait months to be able to get in to see a provider. So when you're being told there's a 3-month wait, what do you do then? How is that fair? And what can be prevented if we change that? Something else that stood out to me at the table, a comment that was made when we were talking about approaching individuals with little value to mental health is, well, telling them if they can't have an open heart, at least have an open mind. Be willing to listen and have that dialogue. And something else that we talked about at my table were, how do we feel that diversity have enhanced our career experiences? So it was beautiful to hear everyone talk about different things they've learned, different perspectives they now have, how much better they feel at work, just being able to know that they are interacting with diverse individuals, and I appreciate that.
Thank you. So, and I had a virtual group, and we were talking about some of like the ways to decrease the stigma and kind of like just taking it towards like institutions that we all are part of. So like asking within our faith and spirit, like our spiritual groups, you know, just like highlighting that it's okay to ask for help from people, like instead of just relying on that faith, and just taking it to like schools and stuff, and just like asking, you know, legislation about like law enforcement, because everyone dials 911, everyone knows to dial 911, but when you're facing a mental health crisis, that might not be the best option or the safest option for you. So we were talking about that 988 number and other local numbers, and just speaking with legislation about having like dispatch counselors, like the way you can call 911 to report a fire, you should be able to call 911 to report a mental health crisis and have a trained counselor to come with them to help solve that situation. And just, we talked about some of the barriers of like cost and how that can stop people from getting help, along with some ways that some people don't like to go because they'll feel like they can't relate, and ways of like gender or ethnic background. So looking for more relatable like providers, even though that can be difficult, and just having like professionals having extra discrimination training and checking their own prejudice and biases and when they're accepting clients.
So one of the things that my group really focused on was having that conversation and opening up those pathways to the conversation of mental health, and how that education can really impact those conversations. Like one of the other facilitators was saying, if people don't know about mental health, then they don't have ways to communicate it, and then they won't know how to ask for help. So that was something that we really focused on, and one of the members in my group also mentioned that in Black communities, often things are very taken very lighthearted. So often someone might mention something that in a more serious tone would be like, oh, are you okay? Let's talk about this. But because of that stigma and the tone difference, it might be overlooked, and that way that person is reaching out for help, but nobody is there to see that ask for help. And so really trying to decrease that stigma, my group talked about how that would be a starting point to help mental health access.
Thank you. So to recap what all of our facilitators were saying, to start it off with our first group here, we are talking about meeting communities where they're at. We can talk about the intersection of race and mental health, but if we're not actually making this care accessible, if we're not considering the people we're serving, then how are we actually going to serve them in an adequate way at all? We also talked about how even it's not just one issue, again, it's other things, housing, class, all of these things that are impacting how we are navigating the world, how we're going through all of this. We need to consider the stress. It's not just that I'm coming to you because I'm hurting because this world and this society is hurting me in turn. We also talked about recognizing our privilege. We need to be aware from when we're talking to other people who are struggling with these issues, what are the privileges that we have? How are they being impacted in ways that we're not? And also our providers. What identities do we not share with them? What identities do we share with them? And how is that impacting the way that we are communicating with them? We also talked about, again, with our last two groups, with Erin and Deb, it's not always one size fits all. We need to have a cultural sensitivity, meeting the communities, again, where they're at. Because I don't look like you, love like you, pray like you, I can't help you unless I'm making an effort, a continuous effort, and holding myself accountable in these spheres to make sure that I'm supporting you in any way that I can. We'll also have our last group. We had two other virtual groups as well that will be shared out by one of our staff members here, Anna Halt.
Hello, it's my pleasure to share out our two virtual groups that were headed by Amber and Eamon, who are part of our Community Tampa Bay group. And in these groups, they actually had a lot of the similar themes that we've talked about here today. Thank you to our facilitators again. But some other themes came up as well. For instance, the emotion behind this topic. For instance, the anger that kind of comes up when we think about our systems and how they could better be serving our people, our communities, and especially those that often get overlooked. Also in our groups, we had a lot of older perspectives, people above the age of 50 who were able to give some insights on how our systems have changed in their lifetimes and what visions they hope to see in the future. As well, a big theme that came up was conversations and making those conversations actually transform into action. So who are we including at this table? What does our table look like? And how are we going from our local level issues into our national level issues? And how are we bridging those two? As well, how does education fit into that? Who is being educated on how much mental health impacts us as individuals, as communities, and how are we taking that forward to our legislators, and not just on national level, but around us? The last point that kind of came up as well was the politicizing of mental health. How is this used, and in what way, and how is it used to actually help instead of hurt? So these were some very interesting themes that came up, excellent conversations that I heard in there, and it all just adds to the general conversation we've been having here. So thank you all.
Thank you, Anna. And that is the perfect close to end our small group discussions and how we went through making that personal political here. We have the one size fits all, the community sensitivity, understanding the impact that all of these issues and these intersectionalities have on mental health and racial equity, and how it impacts us, as Anna was talking about, the legislative and the institutional level. And with that, I will close our small groups and also let our facilitators go back to their tables and invite our panelists back up to answer any more questions and offer any more comments and insights that we can have to have this continuous discussion on racial equity and mental health.
Thank you. As I was listening, I was taking so many notes. Asma, you did a phenomenal job, by the way. So, like, these were things that she highlighted. Perhaps looking at policies that needs to be moved forward. Humanize the space where we learn to listen and embrace our diversity, address structural disparities that contribute to stress and mental health, illness, reflect on our marketing that is being employed, considering connections do matter. So really thinking about how do we reach the communities in which we are participating in to support individuals in the space. Make it okay to ask for help. And she also made a very key point. Education is going to be key. So how do we start training in the K-12 spaces, going to collegiate, going into the communities, making it accessible? And then reflecting on how the 988 number is going to be used, where we can reflect on dispatch counselors. And then peer mentors. Natasha highlighted the beauty of that space, really thinking about how could we capitalize. And then finally, meet the community where they're at and ensure that care is ultimately accessible. So they were key points that were being discussed in the small groups. So at this time, I invite the panelists to really share their thinking about what was discussed and how could we collectively move forward.
Well, number one, thank you for even offering this space to host about mental health. And I think this is one way, again, to break that stigma around mental health. The first and foremost is to start that conversation, and then to educate yourself, and then to advocate, right? Not advocate only for yourself, but maybe advocate for a loved one. And I love the conversations that were going on. I think, these conversations need to happen all the time. Early intervention, early prevention is so important, so vital with our mental health, along with our physical health. And yes, Dr. Sears, as you mentioned, starting early, right? Starting with those elementary students and working their way up so they know that it's okay not to be okay. It's okay to reach out for help. So I love those conversations. I think we need to have more space like this to create that dialogue. And I'm just very, very thankful that you provided that. So thank you.
Absolutely. Well, state funding is a high-level issue. But I would prefer that mental health treatment and substance use treatment just requires a common sense approach. We really need to help people who need help. We would all think and agree that it's insensitive for a person who has stage 1 cancer to go into a doctor's office and then to be told, well, come back when you're at stage 4, and then we'll chat. That's really what's happening very often with people who are experiencing mental illness. You're not bad enough to be admitted. You're not bad or psychotic enough for care, the really good care. So we're going to patch you up and send you home. And when you now intersect with the criminal justice system, now you have our attention. This is a common sense approach, and mental health challenges, mental illness and substance use, it's not occurring in a silo. It's not occurring in a vacuum. It's right here in our face, in our community. And if we keep turning a blind eye to it, the problem is going to get bigger. So what we need to do is recognize that we all have a hand. We all have a role to play in solving this challenge that, in my opinion, is really the next pandemic to hit our shores.
I think moving forward, we need to continue having the conversations that we're having today. And these conversations should stop the minute that everybody's treated equally with dignity and respect. I also feel that we need to normalize mental health care and make it, like you were saying earlier, just an easy topic to talk about. Just like I went to the gym today, I went to see my therapist today. Even during the pandemic, when there was the peak with depression and generalized anxiety disorders, this shouldn't be a taboo anymore. We all need somebody to talk to at some point in our lives. We have our high points, we have our low points. It's okay, okay?
Thank you. So first of all, thank you for having us here today. I know that I have amazing colleagues up here, and I know that I learned a lot just sitting on the panel, which I always like to learn, and I feel great about that this evening. But if you haven't picked it up, I'm very passionate around the funding. You know, we've got to be in a position to, the funding has to, we've got to loosen the criteria around the funding. When I mentioned earlier about the non-reoccurring funds, it's not okay. It's like we just get, you know, a program, an amazing program up and running, and then we don't have funding for the following year. That's a problem. We've got to be able to push in loosening the criteria around appropriate funding. And I think that, you know, that will allow for us to be able to offer additional services and continuity of care. Thank you.
I'm going to bring it to the individual level, you know, looking at the dignity of an individual, the inherent self-worth. Validate these experiences of your peers, your community, your neighbors. Listen, offer that empathetic support, and encourage people to seek help if they need help. Because the more we repress and suppress these emotions, these feelings, these traumas, these experiences that we're dealing with, and especially in these times, they're going to build, and we only have so much capacity. It's like a balloon. You keep inflating it, it will reach its capacity and burst, and that's when we experience crises. So, you know, bring it back to the individual, to the community, and offer that support to your fellow man.
Thank you, panelists. Because what was really highlighting is, one, we have to really reflect on humanity. We're dealing with people, and people reach people. So how we connect with them matters. Additionally, too, I mean, she reinforced it over and over, funding do matter. So as community partners or individuals willing to explore ways to support it, think about donating to it, because it really do matter. And we have wonderful organizations on this panel that actually work to support that space. So reflect on how could you partnership with them to advance their work. And most importantly, be human, because these conversations are difficult. The desire for help, it's not always easy to actually open up and share. So as we reflect on it, be human to the space and refer persons, perhaps having little marketing cards in your office. Hey, I'm not the person who you may be able to talk to, but perhaps you should reach out, make it okay. So without any further ado, we thank you all so much for joining us today, and thank you for helping us to unpack how could we support mental health in the Tampa Bay with the lens of racial equity. Thank you.
Wow, this has been a really incredible program this afternoon, and I'm so grateful for everyone here. First and foremost, I want to say thank you so much to our panel. I know that you're getting lots of applause from our virtual audience, so know that that is there for you and all the support. And thank you to everyone that came here in person and the conversations that we've had today to build out some recognition that dialogue across difference is the way to be able to build up equity, and specifically in this space of mental health, that we are human and that our humanness and connectedness in between humanness is some of the solution that will help us get to equity for all. And so I'm really grateful, first and foremost, to the panel. I'm grateful to Dr. Sears as our moderator, as well as the person who created a fantastic survey for feedback. And at this time in the virtual space, the link to the survey is going to be dropped. You're also going to see it at the end of this showing. We're going to have a QR code that you can easily just take a photo with your phone and scan it in and complete the survey. In the room, we also have those QR codes on your table, so if you wouldn't mind giving some feedback, we'd greatly appreciate that, so that we can make sure that we build on what we're accomplishing here in the Huddle for Change space and continue on in our next series. We'll probably have our next series either late this year or early in 2022. So we are hopeful that you will keep an eye on your email and look for more information for that next topic and that next program. So I want to also say thank you to Esma, who did a fantastic job doing the share out portion, all of our facilitators with Community Tampa Bay. You saw many of them come up on the stage, and a few that joined us virtually. Thank you for that facilitation. You are fantastic facilitators, and we're so grateful to have you as part of our community. And Dave Sobush with the Tampa Bay Partnership with that data overview. Thank you to Dave and the Tampa Bay Partnership for their support in the Huddle for Change series. So with that, I just want to say thank you to everyone who tuned in today, both in person and virtually. We thank you for your vulnerability. We thank you for your connectedness. We thank you for taking these communications and beginning to think of solutions that can build a more equitable Tampa Bay for all of us. So thank you. Have a great night.